guys. Welcome back to Snap Back to Life. And
Hey.
today on our Knowing Your Healthcare team, we have two techs with us, Jessica and Keely. Hi, you guys. How are you guys doing?
Good. I'm
So we're
doing
gonna,
good.
so we're gonna go off and introduce Jessica first.
Okay. Hi, my name is Jessica. I'm a dialysis tech of 9 years, just recently turned nurse. So I'm way more familiar with the tech role than I am with the nurse role. Yeah.
So Keely, introduce yourself.
Okay, my name is Qele, and I have been with Greenfield for a little over a year, and I am certified CCHT. Thank you. I'm sorry, y'all. Excuse me.
That's okay.
Yeah, excuse me. I'm sorry. Is that everything? I'm sorry. I was on the go. My bad,
It's
y'all. I'm so
okay.
sorry.
You good.
Did y'all hear me though? I'm certified CCHT. I've been with Greenfield a little over a year. I did go to Dorsey, in Wayne to study for dialysis, and I did a little over a year course back in 2018, I want to say.
So how long have you both all been in the dialysis field, like period?
Um, so I've been in the dialysis field a total of 9 years. I started as a tech. Then I became what's known as a tech leader, and basically you help like the nurse manager, run things on the floor, make sure the floor is moving smoothly. You are a supports person for any of the up and coming techs who may need help with things. So it's been like a total of 9 years between both roles.
Okay,
Yeah.
that's interesting. I didn't
Yeah.
know that about you, Jess.
Yes. Yes.
And Kelly, how long have you been in this field?
A total of 2 years.
Okay, okay. So you new to this, but you true to this, right?
Yes, I am new to it, but my oldest daughter, she was born with chronic kidney disease, so I've been
Mhm.
dealing with the kidneys for let's see, she'll be 20 in at the end of this month. So that's what
Okay,
got
so
me
for
into
20
it.
years, right?
Yes.
Okay. Okay, so that kind of answers my first question. What made you all interested in the dialysis field? So, Jessica, what made you interested in the dialysis field?
When I was hmm, about 25, 26, I had a friend who suffered from chronic kidney disease, and he had got diagnosed when he was 21. And he used to go to a DaVita, and I used to go sit with him at treatment. And I'd be looking around and stuff, looking at all the texts and stuff, and I'm like, this is interesting. I think I could do this, but I didn't get into the field immediately. I've always been in some form of healthcare, and so I went on Henry Ford's website, and I'm scrolling and I'm scrolling and I'm scrolling, and I'm like, oh, dialysis, and they train you. I was like, okay, I'm gonna see what this is about, and so really that's how I got into the field, and I was really nervous at first. Didn't think I was doing a good job. Didn't think I was gonna make it because it's definitely more difficult than it seems.
Hmm.
And 9 years later, I'm still going. I'm still there today.
Yeah, that's interesting.
hmm
So, what are five things a patient should always know about like their machine and their setup? Because like you and like um other techs, when I first got there, y'all told me, okay, you need to always know this about your
hmm
setup. You need to
hmm
always know this about your script and everything else.
hmm
So, what do you think are five things that patients should always know about their machine or their setup?
Okay. So number one, as far as a safety stance go, patients want to keep their accesses uncovered. That's for their safety as well as for the staff, being able to lay eyes on what's going on. Naturally, patients are cold on a dialysis machine, and so because their blood is going in and out of their body, so they're always cold, and naturally they want to cover up. And there is a chance for a disconnection somewhere in the system, and that's the quickest way for staff to be able to tell, if something's wrong. So that will be number one, because that's really a big safety issue.
Mhm.
um my second thing, I guess, would be um maybe their goal. So a lot of times, especially your long-term patients, they know their bodies. The goal, we set on a dialysis machine, we're removing fluid, and sometimes you'll have patients who have on a lot of fluid, but their body cannot tolerate taking it off. And they'll tell
Mhm.
you, hey, I cannot remove that amount of fluid. Every time I do, something happens. It's very important for staff to listen to the patients because they know their bodies more than we do sometimes.
Mhm.
We want to push them because we don't want them leaving there with extra fluid, but sometimes it's better safe than sorry for them to leave with a little extra on than to take off too much. So, what else? You want to chime in, Keely?
The KTV and a blood volume process, which
Mhm.
is how well their treatment is going for them. That's very important to know, and they'll know that at the end of treatment when the patient is done running. Um, let's see what else. Their bath. They should want to know that.
Mhm.
The dialyzers that they use. And that's what we consider as the artificial kidney, the dialyzer. What else, Jess?
Um,
Um,
their time,
yep.
we're human. We make
Hmm.
mistakes. There have
Yep.
been situations where a patient's supposed to be on the machine 3 hours, 3.5, 4 hours later, the patient is like, is it time to go?
Yeah.
And we're looking like,
Right.
oh no,
Yeah.
like
Yeah. They'd be like,
we're
was I
human.
done? Yeah.
Dialysis is a fast-paced environment, but you have to
Mhm.
be safe and pay attention to what you're doing at the same time.
Yeah. Yeah.
Exactly.
As far as some of
Yep.
them, they do know they pump speeds. Everybody do run at a different pump speed, so they will be like, "Hey, I'm supposed to be at 500," and we're like, "Oh yeah." So pump
Mhm.
speed.
And that has to like do with like your needle, your gauge needle size too,
Hmm.
correct?
Yes.
Yes.
Okay.
Yep.
Yes.
Yep.
Okay. So how does your role as a tech compare to the role of the nurse?
Um, As a role of a tech, we are more front and center with the patients. The nurses, they do their meds and they do the patient assessments, but we are first, the techs are. We figure out how they doing for today. If they had any falls, we kind of make them comfortable enough to talk to us, and that way we can outsource to our social worker, nutritionist if needed. Um, and nurses more so focus on the meds and emergencies if anything happened. Anything else, Jess?
Nope. I was gonna say I will be good at answering that question since my
Yeah.
role recently changed.
Yes, yes,
So
it did.
basically, Keely is on point. Basically, techs are the first line in patient care. Oftentimes, we see the nurses have more patients than the techs do, and so oftentimes we're that first on the scene to say, "Hey, something doesn't look right." And once again, I'll keep reiterating about our long-term patients. Sometimes they get ill on the machine, and you just kind of know when you've been with a patient for so long, hey, something is not right here. It may not be super obvious to like a newer staff member, but a lot of times it's that technician that's going to catch that. And then, thereafter, call the nurse over. I mean, obviously, the nurse is monitoring their patients, but sometimes the nurses can have up to 12 patients at once. And so,
Hmm.
obviously, eyes can't be everywhere at the same time, but each tech is generally responsible for taking care of 4 patients at a time. And so it's, that first set of eyes on the scene if something happens.
Yeah, it's like y'all are like I honestly feel like y'all are first command.
Mhm.
Like like
Mhm.
if I ain't feeling good, I'm like, oh Kaylee,
Mhm.
Jessica,
Yeah.
Yeah.
right. Like I ain't looking for the nurses. I'm looking for my tech, like,
Yeah.
honey, what's something going on, something don't feel
Yeah.
right.
Yeah.
So and then y'all are very good at, responding very well, like and quickly. And I feel like, especially like with new nurses that don't know the
Mhm.
patients, they like, well, maybe we should just take them off. And then you're like, no. she can just either lower her goal or lower her temp, and then we'll see
Mhm.
how she does, and then if it proceeds, then we'll think about taking her off, or think about lowering this or lowering that. So
Yeah.
Yes.
Yeah.
so what is the major difference when it comes to grafts versus fistulas, and what do you guys prefer to work with?
I
Um.
prefer fishless.
Okay.
But Jess, she got me together with my graph. She taught me the ice cream scoop method. So I
Mhm.
have became very good with those, but I do prefer fishless.
Mhm.
Yes.
Um. So when I first became a tech, I you couldn't pay me to stick a graph. They were very difficult. Like Keely said, that definitely was my least favorite. It definitely was like hit or miss for me. Is being able to cannulate them properly. And then I had to get my little groove. I looked to my senior staff, and they kind of gave me some words of advice, like the ice cream scoop method. And then I just kind of passed that down. A tech by the name of Nina, she kind of helped me with that. Um, but so present day, I'm gonna be totally honest. I prefer graphs now, and it's just because a graph is a synthetic material, and you can really grip the graph and stabilize it when you're going in with that needle, whereas a fistula is easier to infiltrate. It'll blow up on you. It's much more delicate than a graft. A graft, you can kind of move the needle around a little bit and kind of wiggle your way in there, but sometimes with the fistula, once you poke through it, that's it. You're gonna blow it, especially with the brand new fistulas.
Yes.
And then also, like, I've talked to a few patients and they have grafts, and they're like, they keep digging in my graft. I'm like, oh no, we ain't digging. This not a vein. This is an
Mhm.
artificial
Mhm.
thing. Like,
Yeah.
Yeah.
They're
don't
gonna
Yes.
be
mess it
having
up.
them digging it right. They gonna mess it up and send you to the
Mhm.
hospital. And
Yeah.
so,
Yeah.
what advice would you give to newcomers that have either a fistula or a graft to really watch out for?
As far as the patients or the staff.
The patient.
Okay. So, patient wise, I'll always educate all my patients to not let staff cangulate you in the same spot, be it a fistula or be it a graft. The surgeon and the work that was done on the arm is absolutely an important factor. Some, I won't down any of them on here, but some are just better than others at what they do. And so that's an important factor. And I was actually the head of the access team. So I would try to direct patients to go to a particular surgeon because I found that his outcomes were much greater than the others. And that makes, a better experience for patients, especially brand new patients who are brand new to dialysis. They don't know what's going on. They scared. They getting information overload. The last thing we ever want for them to have is access issues, because that's almost like the final straw. Like, oh my God, I already got to go through this, and now none of the staff can put a needle in me. Like, I'm just, and they might quit dialysis. That could
Yeah.
be the make or break. You never know. You
That's a
know,
major issue that I'm finding, like, especially like with the younger people,
yeah,
and
they
they
frustrated.
either too overwhelmed by like the home PD, and then they like, okay, it's time to get that catheter out. They're scared because once they get the graft or the fissure, whatever access they choose to get, a lot of times they don't know the information to really watch out for. Like, if
Hmm.
like me having a graft, I'm like, okay, no, you can't dig in this. No.
Yeah,
Right.
yeah.
Yes.
So I just, I try to educate like my newer patients, or if they have a new access, like, don't lay on it. Don't
Hmm.
lift, don't be that my older patients, don't lift them grandbabies, like things of that
Mhm.
nature. They can't put a lot of weight on it.
Mhm.
Yes.
So yeah.
Keely, you have any insight on that?
Um, I know some of them they have an issue with like the pain, so we do recommend that they get the numbing cream.
Hmm.
Um, and again, if they always have concerns, they can always ask for a senior cannulator. It's always good when they are scared to let some of the newer techs cannulate, but definitely is what we call fishing. Is when they say they poking around in the excess. Is what we consider fishing, and that is not
Hmm.
acceptable. Um, But just basically touch the bases on making sure they do the access, the exercises that they're given, work with the stress balls to get the access to mature. And always talk to the tech or the nurse if they have any questions or scared. They can always talk to us and we can re-educate them.
Yeah, and to
Mhm.
add to what Keely was saying, like asking for a more experienced person, it's important for patients to understand that that's their body. You know, if they are uncomfortable, maybe they had a bad experience with somebody, it's okay to say, "Hey, do you mind if so and so puts my needles in?" Or, also don't let people keep putting fresh needles over and over.
Mm-hmm.
Our protocol and our policy is twice.
Yep.
After
Mhm.
that particular staff member should be going to look for someone else. You don't, you can't just keep poking somebody over and over.
Yes,
Exactly.
and that's just stated. And that's for the new patients or just the patient in general. They should always make sure that that tech is listening, and feeling that sight. Because sometimes even us senior cangulators, we'll just get into the groove of just we know it works, but sometimes them access can cloud off, and if we're not listening, and feeling to see, make sure there's no infection or there's nothing going on with that access, we can poke and there's no thrill, there's no bruise. So now
Mhm.
this person, we done stuck them, they done went through the pain, but it's clotted off and we have to get them to the access center. So it's very important for them to know that we have a job and we have to stick to the policy, because if something's going on with that access, we wouldn't know if we just went to go stick that needle straight in.
Exactly. Yep. So, how do you feel about like the newer techs and the way they are trained versus the way you guys were trained?
Um, I think things have changed. I've seen a major change over time. Um, when I came around, I was the baby tech. Like all the techs there had been there like 10 years or more. And it was very, very different. They took you up under their wing, and just showed you things that were your duty, that weren't your duty, because we had so many days. I will say times were a little bit different in dialysis. Understaffing was like crazy. When I say that we had 4 techs and 2 nurses every single day. Every single day, each tech had 6 patients when I first started. And it was like some sink or swim stuff. And
Mhm.
I hate to say it, you kind of learned a lot because of that, because you didn't have a choice. You didn't have anybody to fall back on. If you left the
Mm-hmm.
floor or were gone for too long, there was nobody there to take your place or fill in for
Mhm.
you or things like that. And I think that with more staff, um that's not the case anymore. um I think dialysis has a high turnover. So in a lot of clinics, not just our clinic, in a lot of clinics, you don't have those big 10-year senior staff anymore. A
Mhm.
lot of the staff been there 2 years or less. So it's kind of the blind leading the blind. Like you a baby
Yeah.
here in dialysis, that's a baby over there too. Like the blind leading the
Yes.
blind.
Mm-hmm.
And then occasionally you may have a tech who's been doing it a long time, but then like they the only tech there that's been doing it a long time. And sometimes they suffer from like burnout because
Mhm.
everybody needs help. Everybody has a question. Everybody needs troubleshooting. Everybody needs cannulation help. And so that's a thing in dialysis too. Again, not just our clinic, but I'm hearing that it's a problem everywhere. The turn I
Yes.
think I don't know if the pandemic did something, but a lot of the long timers are like retiring or becoming nurses now and moving on and this and that, and so I think that's the issue.
Mhm.
So
Yeah. Yeah. Still piggyback on what Jess said, is definitely with being a new baby, um, not having adequate staffing. It does play a role, but at the same time, like with me, I didn't have a hard transition because I did come from a larger clinic, so we had more patients per nurse ratio, the techs. So it was okay for me to kind of like fall in slough with the clinic that I have now, only catering to 4 chairs. It was a little bit easier. And with me having the knowledge from the schooling, because my schooling trained me as a dialysis nurse and not just the tech, so I do have like the nursing knowledge as well due to my schooling. So it kind of made it easier for me to flow with the flow of with the pace of the clinic. But
Mhm.
for some of the newer ones that's just coming off the streets, that's just getting trained and learning dialysis and just overall new to it, it is kind of difficult for them to
Mhm.
transition into that.
Mhm.
Yeah, because like
Um,
we have the trainees come in every few weeks or whatever at our clinic, and a lot of them just be like, "Oh my goodness, I'm overwhelmed,"
Yeah. Yeah.
and
They
it's just
yeah,
hiring
like,
yeah, a lot of the new ones get overwhelmed.
they're
Yep. And like
hiring
for me, I did. Oh, go ahead.
no, go ahead, go ahead.
As far as like with the training, because I did join the precepting, so I am like a trainer for some of the new ones. So as far as like they training go, as long as they got a really good preceptor and they actually let like show them the ropes and let them know that this is a teamwork job, it makes the clinic floor flows a little bit better. Once everybody can get in the groove that these you might run this pod, but these patients belong to the whole clinic. Each and every last one of us is responsible for these
Mhm.
patients.
Mhm.
You
right.
might run the pod on this day, or this might just be your pod and someone else run it when they're not here, but all these patients belong to all of us. So if there's a machine beeping over there, Keely go get it. Just go grab it.
Mhm.
Keely might be with a patient or just might be with a patient. I have her back because we're a family in those clinics.
Mhm.
So as
Mhm.
long
Mhm.
as we're training the new people that's coming in, that rule of thumb, the floor, it'll just run smoothly.
Yeah.
Exactly.
And it'll help the senior techs with their burnouts because they do burn
Mhm.
out. Like they've been in
Mhm.
it,
Mhm.
they vets in it, and we
Mhm.
knew
Mhm.
coming in, so we have more energy. We got more spunk for it. But they are burnt out because they've been doing it 15, 10, 8 years.
Mhm.
Mhm.
I think too, the criteria changed in the company from what it used to be. Like when I first started, you needed an associate's degree. Now, I'm not saying education has absolutely anything to do with it, but if you think about it, if you have an associate's degree, how old are you? You roughly 20,
Mm-hmm.
21. This company be hiring 18-year-olds fresh out of
Mhm.
college, first job,
Mm-hmm.
don't know what's going on. And I think there's a maturity that needs to come with it because these are people's lives in your hands, and so I think that plays a factor too. Again, not just with our clinic, just all over. When they
Just all
lowered the
over, yes.
criteria, like she said, it used to be either you were already certified in dialysis or you had some type of degree that was geared towards the healthcare field. Now you're hiring people again, either this is their very first job or their background is clerk or cashier, or not to down, those are very important roles, not to down them, but they have absolutely no experience working with people. And now
Right.
you're
It's a
telling me I
it's a
gotta
culture
come and
shock.
have somebody life in my hand. Like sometimes I feel like that responsibility is a little bit too overwhelming for some people.
Right. It's a
Yeah.
culture shock because you going
Mhm.
from being a retail worker to
Dealing with
being
blood.
with right dealing with blood or dealing with a possible cardiac arrest or because
Yes.
there are serious um things that go on in the clinic. Like just because we are in a clinic don't mean that there are serious life and death situations that
Mhm.
happen that don't happen there. There are
Mhm.
serious
Yep.
life and death situations that happen there all of the time. So you
Yeah.
kind of got to have, like you said, the maturity to
Mhm.
really be able to cope and to deal with those type of things.
Mhm.
Yeah. And
Mhm.
as just stated, the age, it does matter because we have had older nurses that have been in the game 20 plus years that have bowed down humbly to us
Mhm.
techs or even the nurses that's in there because it's a specialty. When you
Mhm.
step
Mhm.
into dialysis, it's a whole nother world. So to be a nurse coming from geriatrics or pediatrics or OBGYN, like they shocked. It's like a whole new world. Even the emergency room nurses is like, hey, I took my hat off to y'all. Like,
Mhm.
I
Exactly.
can't do this. You know what I mean? I'm going back to where I
Mhm.
came from. I don't know how y'all
Mhm.
handle this in here. And you text, oh, y'all handle this with ease. Like, y'all was made
Yeah.
for this. But people
Mhm.
do not understand, like, it's a lot in dialysis. Like, you have to pay attention. And, like just said, that age really matters because they
It
getting young
does.
in there. So they
Mm.
used to partying at nighttime and thinking they could come to work. And this is not a nursing home. You can't do that in this field.
Exactly.
You got to
Mhm.
be alert.
Exactly. Exactly. It's very
Yeah.
fast paced. It's
Mhm.
very multi
Mm-hmm.
everything. Like you
Mhm.
gotta. You got to be able to juggle,
Mm-hmm.
fry,
Mm-hmm.
wash all at the
Right.
same time.
Right.
Yeah, yeah.
Yeah.
It's like you got to know how to
Mm-hmm.
cook, do laundry,
Yeah.
okay, and take care of them kids all at the
Yeah.
same time. You got to have
Right.
eyes
Yeah.
in the back of the head, in the front, the side.
Yeah.
You got to be able to see
Exactly.
everywhere. Okay,
Mm-hmm.
and hear
Yep.
it because sometimes y'all call and like Kayla one day she and I just heard that little voice, Keely, and I'm
Yeah.
like, what? They like, how did you hear her? It's
Yeah.
beeping. I'm like, because I'm alert. You got to be
Yeah.
alert in
Yep.
here to
Yeah.
hear these patients.
Yeah.
Mhm.
Yeah.
Yep. So, what do you feel like? I don't know if we went over this, but what do you feel like your biggest challenges as a tech or a nurse is?
Um, being that senior staff on the floor. Keely can, even 2 years in, she probably can
Yeah,
already relate. Cause I think I had a time even 2 years in, I felt like that being that senior staff. When there's
it's open, baby.
multiple experienced people there for the day, you come in there, you be like, yeah, it's about to be a good day. We all can pull
Mm-hmm.
together. And when you're the only one, or maybe it's only two of y'all, you be like, oh my God. Like, not that you mind helping, but again,
Yeah,
you have your own work to do. You got stuff to
Mhm.
do. You know what I'm saying?
yeah,
And then you go and help the whole floor, and you come back and your stuff then fell apart. And
yep,
that can become very overwhelming. But that's like literally nothing anybody can do. Again, the turnover rate in dialysis is so high. Like, what can you do? And a lot of, and you know what? Another factor is money.
Mhm.
It doesn't, turnover don't necessarily have to do with, oh, I don't like this clinic no more. I Over the
mm-hmm.
years I've met so many techs who will bounce companies. They will go here, and it's competitive. So they will go to this company, they will make their money, and they know that if they apply to the next company, oh, they gotta beat what I'm making over here. Let me jump
Mm-hmm.
Right.
around. So that's a factor too. That's a factor
Yep,
too.
it is. Yeah, the pay
And
rates.
that's very sad because like I was in the hospital pharmacy field, and that it's the same way. Like it don't matter what hospital you go to, the turnover is always really high, and it's always like you said, it's a competitive thing. Because if I know I'm getting 18.95 here, I know I can go somewhere and get 19.20, nineteen
Hmm.
fifty.
Right.
You know what I'm
Yes.
saying?
Right.
And then if I'm certified in certain things, I know I can get 20 something an hour, 30 something an hour if I'm certified in everything and I'm in the
Yeah.
hospital.
Yeah.
Yeah.
Yep.
So yeah, so it's sad.
Yeah.
And
Healthcare.
and for me,
Healthcare in
I
general.
did shop around, like Jess said. Once you get your certification, you get your
Mm-hmm.
experience under your belt. But for me, it wasn't the money. I checked out a couple different locations. I have worked at different locations, and for me, you're welcome. It was the care for the patients that I
Yeah.
feel like
Hmm.
where I work at has excellent care for the patients. I see them getting kidneys. Like I myself, before I went on my medical, I had a couple of my patients while I was gone receiving kidneys. Like the rates in there, our patients, their
Mm-hmm.
spirits are up high.
Yep.
When I did go look at other ones, it was just like, yeah, I can't be here
Mm-hmm.
because it doesn't matter about how much y'all gonna pay me. I'm looking at these patients because that's where my heart is at, and that's why I'm in it. You
Mm-hmm.
know. So yeah,
Mm-hmm.
like Jess said, you do want to get your experience, you do want to get that pay, but when you are in it for the right reasons, the money don't even move you.
Yeah.
Yeah, and
It
that
don't.
also I feel like that also goes for the patients too, because patients, shop around at different clinics too, but it's really about the environment and the comfortability. Like at our clinic, I feel like it's the most comfortable, it's the most
Mm-hmm.
understanding. Y'all not just trying to get us on and get us off, and y'all not
Mm-hmm.
just trying to rush everything. And it's just like if we have a problem and it's not being resolved, y'all gonna get down to the source. Y'all gonna talk to the doctor. Y'all gonna talk to the NP. Y'all
Mm-hmm.
gonna talk to whoever y'all need to talk to be like, okay, my patient is here. She doing her treatments,
Mm-hmm.
but her treat is just something that's off with her treatments. What can we change?
Mm-hmm.
Yes.
So y'all really advocate for us, which I really appreciate, because there are a lot of clinics out there that really just they don't care. That, like you said, it's about the money. And I'm not saying
Mm-hmm.
don't go get your money. Everybody gotta go get a bag,
Mm-hmm.
but
Yeah.
think about it. If you were in their shoes, you would want
Right.
somebody to take care of you to their best capability. So
Mm-hmm.
yeah, it's just it's a lot of compassion. It's a
Mhm.
lot of understandability at our clinic that I have not really seen at other clinics.
Mhm.
Yes.
Mhm.
Yes.
Mhm.
Good as a family. Like any other
Mhm.
family, we have our disagreements, but we do
Right.
know how to come back and function as a family. We have
Mhm.
our
Yep.
grandmas, our mamas, the aunties and uncles, and we gonna love each other just the same. Argue yesterday and we back family right again because we here for
Mhm.
y'all.
Exactly.
Like we gotta make sure number one priority, patient care.
Yep.
Yep. So you guys, I have a little trivia game for you. It's going to be called Favorites Dialysis Edition. So, what is your favorite facility to work
It's long. It's a this a hard question. Like,
at?
I can answer mine right off. Like I got my answer. I came back. Hint hint. I came back to it.
right.
Like we know mine. I
Roster
came back.
dialysis.
Okay, I came back home, y'all. I couldn't
it's
make it out
it's
there.
it's
I
it's
came back home.
no bias over here. It's no bias over here.
I came back home.
Roster
Okay,
dialysis.
so what is your favorite access to cannulate? But I think we kind of went over that. But what is your
Yeah,
favorite access to cannulate?
mine's is official.
Mine is a graph.
Okay. What is your favorite pod to work in?
We all know.
mm,
Mine's is my
yeah, I
pie.
know Keely's favorite. Mine would
We're like,
be mine is a good toss up between 2 and 5. I can't
okay,
lie.
Okay. Okay,
okay.
I get that.
Those are
I
good
like
ones.
pie too.
Yeah,
Listen,
that's a good pie too.
I love my pot, but I just feel like my pot be broke some of the
Yeah,
Don't it though?
yeah,
Like we be
it
running so
do.
good,
That's
and
what
it be
I'm saying.
like, is it
I
time
be
to?
like,
It look,
can
it depend
y'all
on
change
how I
me
feel.
up?
Kayla is
Okay.
always a pleasure. If I could pull you over to another set, like, come on,
Yes,
sister.
yes. I'm like, "Kid, just take me over to the
That's
east
why I was
side real
like, I
quick."
Okay.
cannot, I cannot hands down say Power Five. I just can't. I wouldn't even lie to your face like that.
Exactly.
It
I
might
gotta.
be
But
number two. Number
Power
I
two
do
five
is
my
is
pie like that. Some
yeah,
we be
days,
staying strong. We be saying if we gotta call Richard Ammo, we be like, come on, let's
yeah.
right.
get it together.
It's
Yeah,
like it's
I
not the
like
tech
pie
though.
too.
It's not the tech. It's the mechanics in pie fight.
Yeah,
It's not the tech though.
It's not. It's all about the
Okay.
mechanical work and the machines and the
yeah,
they just need to throw the whole pot away. Just throw.
yeah,
Let's
yeah.
start over.
Yeah,
Water, all kind of
just give us
stuff.
a whole new setup, and then
Right.
keep the
hmm
same patience because I love my patients over there in my pie. We just
Mm.
y'all be sleep. We have a good time over there.
So, what is your favorite scrub brand?
uh,
Grey's Anatomy and Carhartt.
I
I
like
love Grey's
Skechers.
Anatomy. I
I
like
like
Skechers
Skechers.
too because
I just
Skechers
got
got
down
that.
with the Skechers. I
It's
love
got that
Skechers.
Okay,
nice stretch to it.
I'm gonna
Yes,
have to check the
yes,
sketches out. I'm gonna have to check
hmm
them
yes.
out.
They across the street over there. Shout
Okay,
out to whatever the name of that store is. Right across
Scrubs
the
and
street from the
Beyond.
clinic.
Oh,
Discount
the new.
uniform.
Okay,
Yeah.
okay, yeah.
She
I'm
give
gonna
you a
check them
discount
out.
too, for real.
Okay, okay. Well,
Yeah.
I'm gonna have to go check her out because
Yeah.
sketches.
They're not
Okay.
that
Yeah.
expensive.
No.
Yeah, but
Okay.
that Grey's Anatomy, like when I was working, that
Yeah.
Grey's Anatomy, them scrubs, it's like luxury.
It's
I'm
like
about to
Y'all be
light.
get
like,
some.
y'all
It's
be
light.
like, it's light, but it's heavy at the same time, if that
Okay.
makes sense.
They fit so
Like,
good, Jess. You gonna like them. You
yeah,
gonna
Yeah,
like
fall
you
in
know
Skechers
how
love.
like
them,
that too though. I like so I'm gonna have to try them then.
yeah,
Yeah,
You
they
gonna
because you
real
fall in
know how
love.
Skechers
like,
real light. They seem like they thin, but they good quality
Yeah.
material. They real
mm-hmm,
light and they
Yeah.
stretchy. They fit fit your figure and stuff.
And then
I
mm-hmm,
Grey's
like
Anatomy, a lot of they stuff don't. You can't penetrate it.
okay.
So
yep,
you will like them. And then Carhartt, they featherweight. I really like Carhartt. They did
Okay.
they big one when they came out with the scrub lines. They did they big
Mhm.
one.
And
I got a
I
okay,
like
couple.
healing hands. They got those over there too. I don't know if you ever seen it with the tree on the scrubs. They got like a tree
Okay,
on there.
I'm gonna
Yeah.
have to
yeah.
check
Healing
them
Yeah.
out.
hands. I used to get healing hands a lot because I could buy like at it was another like discount one. It's like over on Wyoming or something. They're
Okay.
closed now. But
Okay.
I could buy like 5 pens for like the price of two. And I'd be like,
Mm-hmm.
yeah, hook me up. Hook
Mm-hmm.
me up.
Yes.
Okay.
So, okay, lastly, like I said, no bias, but who's your
No, but
favorite patient?
Ooh,
no
wee, my
bias.
poo
Okay.
poo. My poo poo Kayla. Come
And she
on
said,
now.
look, and she sitting here
Period.
so pretty and sweet in the
Period.
middle.
Okay.
City come, hey Jeff, do she not come shutting it down? Okay, it be like club dialysis. I be waiting on her to come through with the cute outfits on. Like, come
My
on,
Thank
glamour
Kayla.
girl.
you.
My pretty
Thank
girl.
you.
Okay.
Come through,
I'm
Kayla.
like, what she gonna wear today? Come on with the
And I
J's
gotta say,
on.
my
I
two
I
homeboys.
was
I
I
can't leave
was
my homeboys
trying.
out. We can't
Oh,
leave
yeah,
out.
okay.
We can't leave out Mr. Powell. Shout out. You know, he done
Oh
got
Mhm.
his.
yeah, that's
He
my
done
guy
he done he
too.
done graduated on us. That's our guy. And
Yeah.
Mr. My champ. I can't leave my champ out. Can't leave out
But I
Mr.
be like, what my
Chandler.
pretty girl gonna wear today? Look, cause
Okay.
honey, you do not
Thank
look like what you
you.
going through. You hear
She
me?
do
Thank
not.
and
She
You
that's
never do.
that's
You
our whole
never
goal. I
do.
be like, look,
it
listen,
be up
I know
high.
you going through it right now, but you ain't gotta look like what you going through,
You
okay?
don't.
Yeah.
You can push through. And then
Hmm.
sometimes y'all know if I come in with
A
a
hat.
jogger suit or a hat
Yeah.
Okay.
or just if I'm coming with pajamas, y'all already know like something
Yeah.
is wrong.
Yeah.
So if
Yeah.
Something
okay,
is
It's
something wrong,
wrong.
or
wrong.
you getting ready for the day like you did me the other day. I said, Kayla,
Exactly.
boo, what?
Right.
Baby girl, it's early, baby girl. It's early. Never mind. This ain't your shift.
Exactly.
Like this one ain't
Yeah,
your shift. I'll give it to you this time.
Hmm.
exactly. Like that's the only time I'm gonna come in pajamas if I'm really just not feeling good or if I got
Hmm.
somewhere to be later
Yeah.
on in the day.
Hmm.
But that's the support that y'all give each other as a family of patients. Like they even look forward to it. You know,
Yeah.
Hmm.
they go, okay, you know, all of them. You got
Yep.
your favorite
Mr.
patient, Mr. D.
Diggs, Miss Jackson. Yep.
Hey,
I'll be
and
like,
they
oh,
okay.
hey, Mr.
It's just a whole family in there. They all
Diggs.
support each other, and oh, you getting a kidney? They be so happy for each other. It's not a downer thing. It's just like I'm
Hmm.
sad you leaving me, but I'm so happy
Hmm.
that you getting this experience. It's
Yeah.
just all
Right.
love. So yeah.
Mm-hmm. Yep. Okay, you guys. It was so glad. I'm so glad you guys came and talked to me about the tech
Yes.
world and
Thank you
dialysis.
for having us.
Thank
Thank
you. You guys
you.
have any closing remarks?
Congratulations,
Um,
Jess.
Thank you.
You're
Yes.
It's
welcome.
start back picking up. Look, it's
It's
been a
always a
little
place to
rough.
come.
I gotta
Yeah.
go. I work midnight, so it's hard.
Yeah.
Okay.
Um,
It's always a
but
blessing
I
when you
just
bless
want to
us.
say, like, to any person newly diagnosed with kidney failure or anything like that, um, I love you. If don't nobody else tell you, um, fight that good fight. It's not
Yes.
easy, and I won't even sit here and be like, I know what you're going through, but fight that good fight. Many years ago, we didn't have things like dialysis and things like that. And so just try to have that positive mindset. Well, like, at least I have this to hold on to, and things like that. Like, just stay up. Just try your best. That would be my words of
Yes.
encouragement.
Yes. Yep.
Yes. And I just want to piggyback off of what Jessica said. If anybody didn't tell you, we love you over here at
Hmm.
SB2L. I'm
Hmm.
here to talk to you anytime that you want to. If you're looking at this through YouTube, you can go through my email or you can go through whatever social media is attached to my YouTube page and just reach out to me. If you
Hmm.
feeling frustrated, I get it because I've been there. I've been frustrated. I've been in the point where I was like, yeah, run me off this machine, like right now. Like I'm ready to
Hmm.
go. So it's just it is tough, but like Jessica said, you can get through it. Fight that good fight because it's better things on the horizon. And sometimes the horizon looks very far away and sometimes it looks very close. But just keep on going, keep on trucking.
Right.
Yes.
Yeah.
Um, my heart kind of go out to the mothers, the ones with the babies, like I myself. Keep your head up. I know that it is a hard fight, but keep pushing. Stay upfront with your child's health. If you need to cry, just go off in the corner and just cry it out. It's always good to have that good family support. Reach out. Any family members, like have your family back. This is a hard thing to go through. The friends out here, when your family friends going through it, support them. Their life
Mhm.
is changing. They can't do a lot of things that y'all can do no more, but you can change and you can do the things with them that they can enjoy because their life is not over, and they can get a second chance at it as long as they stay in a positive mindset, because it's all about
Yep.
mindset.
Yep.
Mhm. Yep. Okay, you guys. Thank you for joining,
Thank
and
you.
see you guys next time on SB2L.